Question 1. A client receiving 4 heparin develops sudden back pain and hematuria. What is the nurse's priority action? A. Slow the infusion rate. B. Stop the infusion immediately. C. Administer protamine sulfate. D. Notify the provider. Answer: B. Stop the infusion immediately. Rationale: these are signs of internal bleeding, a life-threatening complication of heparin. The nurse must stop the infusion first before any further intervention. Antidote: protamine sulfate. May follow, but stopping exposure is priority. Question 2. A nurse is preparing to administer digoxin. The client's potassium level is 2.9 milliequivalent/L. What should the nurse do? A. Administer the medication. B. Hold the dose and notify the provider. C. Give potassium after digoxin. D. Reduce the dose. Answer: B. Hold the dose and notify the provider. Rationale: hypokalemia increases risk of digoxin toxicity. Giving digoxin in this state can trigger fatal dysrhythmias. The medication must be withheld. Question 3. A client on warfarin has an INR of 6.2 with no bleeding. What is the nurse's best action? A. Administer vitamin K immediately. B. Hold warfarin and notify provider. C. Continue medication. D. Start heparin. Answer: B. Hold warfarin and notify provider. Rationale: INR greater than 4.5 without bleeding equals hold warfarin. Vitamin K is usually reserved for higher INR or active bleeding. Overcorrection risks clotting. Question 4. A client receiving 4 potassium chloride reports burning at the 4 site. What is the nurse's first action? A. Slow the infusion. B. Stop the infusion. C. Apply a warm compress. D. Flush the line. Answer: B. Stop the infusion. Rationale: for potassium is highly irritating. Burning suggests extravasation, which can cause tissue necrosis. Stop infusion immediately to prevent damage. Question 5. A nurse is administering insulin glargine. Which action is correct? A. Mix with regular insulin. B. Administer 4. C. Give subcutaneously without mixing. D. Give before meals. Answer: C. Give subcutaneously without mixing. Rationale: insulin glargine is a long-acting insulin and must not be mixed with other insulins. Mixing alters its pharmacokinetics. Question 6. A client receiving morphine 4 becomes difficult to arouse with respirations of 8 per minute. What is the priority action? A. Stimulate the client. B. Administer naloxone. C. Reduce the next dose. D. Apply oxygen. Answer: B. Administer naloxone. Rationale: this is opioid-induced respiratory depression, a medical emergency. Naloxone reverses opioid effects immediately. Question 7. A nurse is preparing chemotherapy medication. Which PPE is required? A. Sterile gloves only. B. N95 mask only. C. Chemotherapy gloves and gown. D. Surgical mask and gloves. Answer: C. Chemotherapy gloves and gown. Rationale: chemotherapy drugs are cytotoxic. Proper PPE includes chemo-rated gloves and gown to prevent exposure. Question 8. A client on phenytoin 4 develops hypotension during infusion. What should the nurse do? A. Increase infusion rate. B. Stop or slow the infusion. C. Administer more medication. D. Flush with dextrose. Answer: B. Stop or slow the infusion. Rationale: rapid 4-phenytoin can cause severe hypotension and dysrhythmias. Infusion must be slowed or stopped immediately. Question 9. A client taking metformin is scheduled for a CT scan with contrast. What should the nurse do? A. Continue medication. B. Hold metformin before and after procedure. C. Double the dose. D. Give insulin instead. Answer: B. Hold metformin before and after procedure. Rationale: metformin plus contrast dye increases risk of lactic acidosis. Medication must be withheld. Question 10. A client receiving vancomycin 4 develops flushing and hypotension. What is the most likely cause? A. Allergic reaction. B. Red man syndrome. C. Toxicity. D. Infection. Answer: B. Red man syndrome. Rationale: rapid vancomycin infusion causes histamine release, leading to flushing, hypotension, and rash. Slow the infusion to prevent recurrence. Question 11. A client receiving 4-nitroprusside develops confusion and metabolic acidosis. What is the nurse's priority action? A. Increase 4 fluids. B. Stop the infusion. C. Administer sodium bicarbonate. D. Check blood pressure. Answer: B. Stop the infusion. Rationale: nitroprusside can cause cyanide toxicity, presenting with confusion and metabolic acidosis. The priority is to stop the source immediately before further treatment. Question 12. A client on lithium reports nausea, tremors, and confusion. What is the nurse's best action? A. Give antiemetic. B. Hold lithium and notify provider. C. Encourage fluids only. D. Administer next dose with food. Answer: B. Hold lithium and notify provider. Rationale: these are signs of lithium toxicity. Continuing the drug can lead to seizures or coma. Immediate withholding is critical. Question 13. A nurse is administering 4-push-adenosine for SVT. Which action is essential? A. Infuse slowly over 5 minutes. B. Give through distal 4 line. C. Rapid 4-push followed by flush. D. Mix with saline before administration. Answer: C. Rapid 4-push followed by flush. Rationale: adenosine has an extremely short half-life, 10 seconds. It must be given rapidly with a flush to reach the heart effectively. Question 14. A client on continuous insulin infusion has a blood glucose of 72 mg per deciliter. What is the nurse's priority action? A. Continue infusion. B. Stop infusion and give dextrose. C. Decrease rate slightly. D. Recheck in 1 hour. Answer: B. Stop infusion and give dextrose. Rationale: this is hypoglycemia risk in a critically ill patient. Immediate correction is required to prevent neurologic damage. Question 15. A client receiving magnesium sulfate 4 has absent deep tendon reflexes and respirations of 10 per minute. What should the nurse do first? A. Continue monitoring. B. Stop infusion. C. Administer calcium gluconate. D. Increase 4 fluids. Answer: B. Stop infusion. Rationale: signs of magnesium toxicity include respiratory depression and loss of reflexes. Stop the infusion first, antidote follows. Question 16. A nurse is administering clozapine. Which lab value requires immediate action? A. Hemoglobin 12G/DL. B. WBC 2000/mm superscript 3. C. Platelets 200,000/mm superscript 3. D. Sodium 138 milliequivalent/L. Answer: B. WBC 2000/mm superscript 3. Rationale: clozapine can cause agranulocytosis, a life-threatening drop in WBCs. This value is critically low and requires immediate discontinuation. Question 17. A client on furosemide 4 develops muscle weakness and arrhythmias. Which electrolyte imbalance is most likely? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Answer: B. Hypokalemia. Rationale: loop diuretics like furosemide cause potassium loss, leading to weakness and life-threatening dysrhythmias. Question 18. A nurse is administering packed RBCs. After 10 minutes, the client develops fever and chills. What is the first action? A. Slow the infusion. B. Stop the transfusion. C. Give antipyretics. D. Notify provider. Answer: B. Stop the transfusion. Rationale: suspected transfusion reaction, always stop transfusion immediately before any other step. Question 19. A client taking theophylline has a serum level of 25 micrograms per milliliter. What is the nurse's action? A. Continue medication. B. Hold dose and notify provider. C. Give next dose early. D. Increase fluid intake only. Answer: B. Hold dose and notify provider. Rationale: therapeutic range is 10 to 20 mcg/ml. Level of 25 indicates toxicity, risking seizures and arrhythmias. Question 20. A nurse is administering 4-amphotericin B. Which adverse effect is most concerning? A. Fever and chills. B. Nausea. C. Nephrotoxicity. D. Headache. Answer: C. Nephrotoxicity. Rationale: amphotericin B is notoriously nephrotoxic. Kidney failure is the most dangerous complication requiring close monitoring. Question 21. A client on heparin infusion has an APTT of 120 seconds. What is the nurse's priority action? A. Increase infusion rate. B. Stop the infusion. C. Continue current rate. D. Administer warfarin. Answer: B. Stop the infusion. Rationale: therapeutic APTT is typically 1.5 to 2.5 times normal, 60-80 SEC. A value of 120 indicates severe over-anticoagulation, placing the client at high risk for bleeding. Stop infusion immediately. Question 22. A client taking MAOI antidepressants eats aged cheese and develops severe headache and hypertension. What is occurring? A. Serotonin syndrome. B. Hypertensive crisis. C. Allergic reaction. D. Stroke. Answer: B. Hypertensive crisis. Rationale: MAOIs plus tyramine, aged cheese. Massive catecholamine release hypertensive crisis, which can lead to stroke or death. Question 23. A nurse is administering 4-potassium. Which finding requires immediate intervention? A. Infusion via pump. B. Diluted solution. C. Urine output 20 milliliters per hour. D. Foresight intact. Answer: C. Urine output 20 milliliters per hour. Rationale: low urine output indicates renal impairment, increasing risk of fatal hyperkalemia. Potassium should not be given when kidneys cannot excrete it. Question 24. A client on warfarin is started on trimethoprim sulfamethoxazole. What is the priority concern? A. Decreased INR. B. Increased bleeding risk. C. Reduced antibiotic effect. D. Hyperglycemia. Answer: B. Increased bleeding risk. Rationale: this antibiotic potentiates warfarin, increasing INR and risk of dangerous bleeding. Question 25. A nurse is administering 4-morphine. Which assessment finding requires immediate action? A. BP 160. B. Respirations 10 per minute. C. Pain score 8 out of 10. D. Heart rate 90 BPM. Answer: B. Respirations 10 per minute. Rationale: respiratory depression, less than 12 per minute, is a life-threatening opioid effect. This takes priority over pain control. Question 26. A client receiving TPN develops sudden hyperglycemia, glucose 350 mg per deciliter. What is the nurse's best action? A. Stop TPN immediately. B. Slow the infusion rate. C. Administer insulin as prescribed. D. Flush the 4-line. Answer: C. Administer insulin as prescribed. Rationale: hyperglycemia is expected with TPN. Management is insulin administration, not stopping TPN abruptly, which risks hypoglycemia. Question 27. A client on digoxin develops blurred vision and yellow halos. What should the nurse do? A. Administer next dose. B. Hold medication and notify provider. C. Encourage fluids. D. Give potassium supplements. Answer: B. Hold medication and notify provider. Rationale: classic digoxin toxicity signs. Continuing the drug can lead to fatal arrhythmias. Question 28. A nurse is preparing to give 4-push furosemide. What is the correct action? A. Push rapidly. B. Administer slowly. C. Mix with potassium. D. Give IM instead. Answer: B. Administer slowly. Rationale: rapid 4-furosemide can cause ototoxicity, hearing loss. It must be given slowly. Question 29. A client taking aspirin develops ringing in the ears. What is the nurse's action? A. Continue medication. B. Hold dose and notify provider. C. Give antacid. D. Reduce dose slightly. Answer: B. Hold dose and notify provider. Rationale: tinnitus equals early salicylate toxicity. Immediate action prevents progression to severe toxicity. Question 30. A client on beta blockers, propranolol, has a heart rate of 48 BPM. What should the nurse do? A. Administer medication. B. Hold dose and notify provider. C. Give atropine immediately. D. Recheck in 2 hours. Answer: B. Hold dose and notify provider. Rationale: beta blockers cause bradycardia. HR less than 60 BPM is a common hold parameter to prevent hemodynamic instability. Question 31. A client receiving 4 benzodiazepines, lorazepam, becomes unresponsive with shallow respirations. Which medication should the nurse anticipate? A. Naloxone. B. Flumazenol. C. Protamine sulfate. D. Vitamin K. Answer: B. Flumazenol. Rationale: flumazenol is the antidote for benzodiazepine overdose. It reverses CNS depression and respiratory compromise. Question 32. A client on multiple high-dose opioids suddenly develops pinpoint pupils and respiratory rate of 6 per minute. What is the nurse's first action? A. Call provider. B. Administer naloxone. C. Apply oxygen. D. Stimulate the client. Answer: B. Administer naloxone. Rationale: severe opioid toxicity. While oxygen helps, naloxone reverses the cause, making it the priority. Question 33. A nurse is administering calcium channel blockers, verapamil. Which finding requires holding the medication? A. BP 150/90. B. HR 52 BPM. C. Pain level 6 out of 10. D. Temperature 37 degrees Celsius. Answer: B. HR 52 BPM. Rationale: Calcium channel blockers slow heart rate. Bradycardia, less than 60 bpm, is a contraindication for administration. Question 34. A client receiving 4-acyclovir develops rising creatinine levels. What is the nurse's priority action? A. Continue therapy. B. Increase infusion rate. C. Notify provider. D. Administer diuretics. Answer: C. Notify provider. Rationale. Acyclovir can cause nephrotoxicity. Rising creatinine indicates kidney injury requiring immediate evaluation. Question 35. A nurse is administering regular insulin 4 and notices the 4 line is primed with dextrose solution. What should the nurse do? A. Continue infusion. B. Flush with saline before starting. C. Add more insulin. D. Slow infusion. Answer: B. Flush with saline before starting. Rationale. Dextrose in the line can alter insulin delivery and cause inaccurate dosing. Always flush incompatible solutions. Question 36. A client taking isoniazid, INH, develops numbness and tingling in the hands. What should the nurse anticipate? A. Stop medication immediately. B. Administer vitamin B6, pyridoxine. C. Increase dose. D. Restrict fluids. Answer: B. Administer vitamin B6, pyridoxine. Rationale. INH causes peripheral neuropathy due to vitamin B6 deficiency. Supplementation prevents nerve damage. Question 37. A client on spironolactone has a potassium level of 5.9 milliequivalents/L. What is the nurse's action? A. Continue medication. B. Hold medication and notify provider. C. Give potassium supplements. D. Increase dose. Answer: B. Hold medication and notify provider. Rationale. Spironolactone is potassium sparing, and this level indicates dangerous hyperkalemia, risking cardiac arrest. Question 38. A nurse is administering 4 vancomycin and notes the infusion is running over 30 minutes. What is the nurse's action? A. Continue infusion. B. Increase rate. C. Slow the infusion. D. Stop permanently. Answer: C. Slow the infusion. Rationale. Vancomycin must be infused over at least 60 minutes to prevent red man syndrome. Question 39. A client taking glipizide becomes diaphoretic and confused. What is the priority action? A. Give insulin. B. Check blood glucose. C. Administer oral glucose. D. Call provider. Answer: C. Administer oral glucose. Rationale. This is hypoglycemia. Immediate glucose administration takes priority over confirmation when symptoms are clear. Question 40. A client on long-term corticosteroids suddenly stops medication and develops hypotension and weakness. What is occurring? A. Allergic reaction. B. Adrenal crisis. C. Infection. D. Drug toxicity. Answer: B. Adrenal crisis. Rationale. Abrupt withdrawal of steroids causes adrenal insufficiency, leading to life-threatening hypotension. Question 41. A client receiving 4 heparins suddenly develops shortness of breath and chest pain. What is the nurse's priority action? A. Stop the infusion. B. Administer protamine sulfate. C. Apply oxygen. D. Notify the provider. Answer: C. Apply oxygen. Rationale. This suggests a possible pulmonary embolism or acute complication. Airway and oxygenation, ABCs, take priority before stopping medications or giving antidotes. Question 42. A client on warfarin presents with severe headache and slurred speech. What is the nurse's first action? A. Check INR. B. Stop warfarin. C. Activate emergency response. D. Administer vitamin K. Answer: C. Activate emergency response. Rationale: these are signs of a possible intracranial hemorrhage. This is a medical emergency, requiring immediate rapid response activation. Question 43. A nurse is administering 4 potassium chloride. Which situation is most dangerous? A. Infusion via pump. B. Diluted in 4 fluid. C. Given as 4 push. D. Monitored ECG. Answer: C. Given as 4 push. Rationale: for potassium must never be given 4 push. It can cause instant cardiac arrest. Question 44. A client receiving morphine PCA is found unresponsive. What is the nurse's first action? A. Stop PCA pump. B. Administer naloxone. C. Call provider. D. Check vital signs. Answer: stop PCA pump. Rationale: in an unresponsive patient on opioid PCA, you already have enough evidence of likely opioid overdose. The priority is to stop the source of the opioid immediately. Then assess, support airway, and give naloxone. Nclex rule: if cause is obvious and life-threatening, stop the cause first, not assess first. Question 45. A client taking ACE inhibitors, lisinopril, develops swelling of the lips and tongue. What is the nurse's priority action? A. Stop medication. B. Administer antihistamines. C. Maintain airway. D. Notify provider. Answer: C. Maintain airway. Rationale: this is angioedema, which can rapidly obstruct the airway. Airway management is priority over all other actions. Question 46. A nurse is administering 4-phenytoin. Which solution should be used to flush the line? A. Dextrose 5%. B. Normal saline. C. Lactated ringers. D. Sterile water. Answer: B. Normal saline. Rationale: phenytoin precipitates in dextrose solutions. Only normal saline is compatible. Question 47. A client on methotrexate develops mouth sores and low WBC count. What should the nurse anticipate? A. Increase dose. B. Stop medication. C. Administer leucovorin. D. Give antibiotics only. Answer: C. Administer leucovorin. Rationale: leucovorin, folinic acid, is the antidote that reduces methotrexate toxicity and protects healthy cells. Question 48. A client receiving blood transfusion develops hypotension, back pain, and dark urine. What is the nurse's first action? A. Notify provider. B. Stop transfusion. C. Administer fluids. D. Send blood sample. Answer: B. Stop transfusion. Rationale: classic hemolytic transfusion reaction. First step is always stop the transfusion immediately. Question 49. A client on loop diuretics is also prescribed digoxin. What is the priority concern? A. Hypernatremia. B. Digoxin toxicity. C. Fluid overload. D. Hypertension. Answer: B. Digoxin toxicity. Rationale: loop diuretics cause hypokalemia, which increases risk of digoxin toxicity, leading to fatal arrhythmias. Question 50. A nurse is caring for a client on multiple medications who suddenly develops rash, hypotension, and wheezing. What is the nurse's first action? A. Administer epinephrine. B. Stop all medications. C. Call provider. D. Start 4 fluids. Answer: A. Administer epinephrine. Rationale: This is anaphylaxis. Epinephrine is life-saving and must be given immediately to reverse airway constriction and shock. High-risk medications can make or break your NCLEX, and now you've trained where it matters most. If you made it through all 50, you're not just studying, you're preparing to think like a safe, competent nurse under pressure. Keep practicing, stay consistent, and don't ignore the details, because in real life, they save lives. If this helped you sharpen your clinical judgment, make sure you subscribe and stay ready for the next level. Your success on NCLEX starts with what you do after this video.